Welcome to this special episode of The Switch. My name is Lindsay Otto, Nonprofit HR's Marketing and Communication Associate for Editorial and Content, and I am thrilled about today's episode. We will hear from another excellent woman named to Nonprofit HR's 2023 Social Impact Women to Watch list. For a bit of background on this campaign, each year during Women's History Month, Nonprofit HR proudly recognizes women across North America who have made significant contributions to nonprofits, associations, foundations, social enterprises, and the communities that they serve. This special series of The Switch features the 24 finalists named to this year's list due to their extraordinary leadership, unwavering dedication, and impactful achievements. So listen in to today's episode as Atokatha Ashman Brew, Managing Director of Marketing and Strategic Communication for Nonprofit HR, and Dr. Karen West, President and CEO of the American Dental Education Association, catch up and learn more about Dr. West's stellar contributions to the sector. Dr. Karen P. West received her undergraduate degree from the University of Louisville in 1977 and is a 1982 graduate of the University of Louisville School of Dentistry, where she received her Doctor of Dental Medicine degree. She had completed a general practice residency at the Medical College of Georgia in 1983 and was a 1992 graduate of the University of South Carolina School of Public Health, where she received her Master of Public Health degree in Health Administration. From 1990 until 2007, she was a faculty member at the University of Kentucky College of Dentistry. In 2007, she became Dean of and served as a tenured professor in the Department of Biomedical Sciences at the University of Nevada, Las Vegas School of Dental Medicine until June of 2019. And in July of 2019, Dr. West became the President and CEO of the American Dental Education Association, headquartered in Washington, D.C. Dr. West has been involved in ADEA throughout her career, and in 2018 received the ADEA Distinguished Service Award. And without further ado, here's Atokatha and Dr. West.
Hello again, Dr. West.
Well, thank you. I'm happy to be here with you guys again.
Yes, congratulations to you on making the finalist list for the 2023 Women to Watch in Social Impact. We're just so excited about this conversation that I'm going to have with you today, and more importantly, the great work that you're doing in the community and the impact that you continue to have in your career.
Well, thank you so much. It's a great honor for me to be here, and I was totally shocked, but very, very pleased. So I'm happy to share anything about my experiences that might help someone else who wants to navigate this sort of a career.
Thank you. Let's just jump right into the conversation then. First, Dr. West, what drew you to ADEA as a mission, as well as the social impact space in general?
Well, I was involved in dental academics, and ADEA is the association for the dental institutions and the dental programs. So I've been involved with it all my life. I've been involved with it since I was a student, actually. So we're talking 40 some odd years. And I've seen through the years all that it has done and accomplished for our profession, for our students, for our faculty. And I have seen the outreach that has come about from ADEA leading the efforts. And when I had the opportunity to join ADEA, it was actually at the end of my academic career. I was a dean for several years. It was like a dream come true. This is where I could make a huge impact if I really, really worked hard. And that was one of the reasons that I took the position, so I could hopefully affect people nationally, even globally.
Wow. I mean, that's getting into the impact that you've had on the community at large outside of academia. Did you foresee that something like this would potentially happen?
Well, when I started out in academics, I became a public health dentist. So in public health, you try to do the best you can for everybody. You really work hard at outreach, at providing services to the community. And that's what I did basically for the first 10 to 15 years of my career. I worked in a public health clinic for the underserved. And I think that gave me an eye-opening experience Because I was from a small rural community in Kentucky. Everyone looked alike, everybody went to school together, and you didn't have a lot of interactions with people outside of your own little group. And when I went down to Georgia, Medical College of Georgia in Augusta, and became a public health clinician, my eyes were opened to the needs, to the poverty, not just with dentistry, but with overall health in general. And at that time, I decided that's what I was going to focus on in my career.
How are you able to mobilize and bring others along in the various communities or stakeholder groups that you collaborate with daily?
Well, I think I've learned a lot from my mentors. I had very, very good mentors as I came throughout my career. And many of them, I look back on, taught me different things. They taught me communication, but I think the biggest thing I learned was that Americans were so egocentric because we thought we were the best in everything. But realistically, we can learn from others. We can learn from other countries. We can learn from other health profession disciplines. I took that and applied it to my work with the thought that I was not going to be egotistical if I could help it. Sometimes it just creeps in, unfortunately. But I was going to seek out answers or seek out people, groups, to help deliver the impact that we wanted to deliver in whatever job I was in. So it's that collaboration and that feeling that we can work together as a whole much better than individually and in silos.
Yeah, I mean, and it seems like that would be very important for an organization like ADEA, considering, there's general education that's happening across the entire globe. So innovation must be springing up across the globe as well.
It is. It really is. As a matter of fact, I'm going to the annual session of the Dental Education Group in Europe and making a presentation there on something we're doing in interprofessional education. And it's a two-way street. They learn from us and we learn from them, but we can take and apply things back at our home country that I think will serve our membership and our communities well. And that's what I strive to do, is reach out whenever I can. And I've tried to leverage my staff that I work with those same opportunities. So they're able to interact with different groups, different people who might be physicians, nurses, veterinarians, to learn what they can from them about how to implement our visions.
Yeah. How fast are things changing in the dental education community, academics wise and also in practice?
Oh, it's huge right now. It's changed a lot. COVID pushed us forward 20 years, I think, beyond where we would have been. But I think one of the most exciting, yet a bit scary impacts is going to be AI. How we deal with that, how we're able to, I guess, rein it in and not let it get out of hand. We hear so much in the academic world now about that and students using different mechanisms, but I think the opportunities are huge. The technology has advanced so much since COVID. I think people spent COVID inventing things while they couldn't do anything else. The practice of dentistry has changed also, not just because of the technology, but now we have a lot of dental service organizations that provide care. And these are groups of practices that may be owned by a corporation or individual dentists, and they hire a lot of our students right out of school. And the students decide to use that time to save money and maybe have their own practice, but we're seeing less and less of the individual private practices now because you can do more in a group practice because you can afford more technology.
And I mean, so you mentioned earlier that you've had some mentors who have been really instrumental, to you in your career. And that communication was one thing that, was really drilled down into you early on. What else would you say is an important skill set that you have acquired, especially as a leader in your space?
I think that I have become an empathetic listener. I Perhaps in the past, I was more focused on getting the job done and didn't take the time to share and celebrate with people our successes, and also discuss and talk about our failures and what we learned from that. I was too focused on moving from one project to the other and getting things done. I have learned that that is not a successful leader. That is not a successful manager. You have to be willing to put yourself in your employee's place sometimes and understand what they are going through. You may not be able to make everybody happy and make the decisions that they want you to make, but you have listened and you have heard their viewpoints. And I think that's one of the most important thing I have learned, both from mentors and just having done it over the years.
Looking to integrate talent into your mission strategic plan? During annual strategic planning, organizations often overlook what talent is needed to meet their goals. Partner with Nonprofit HR for your organization's talent management needs. We offer HR outsourcing and project-based consulting, including strategy and advisory, retained search, total rewards, and equity, diversity, inclusion, and justice. We also offer customized trainings for your workforce. Join the many social impact organizations that have trusted Nonprofit HR to help them increase mission impact through their people. Visit nonprofithr.com.
So how would you say your quest, being an empathetic leader, how has that played into your people management philosophy over the years?
Well, I think it's very important for me to communicate my vision to both our employees, our board, and our members. And if I'm not enthusiastic about it, how can they not be enthusiastic about it? How can they be? Any mission, I think, that we undertake as an organization, we have our mission and vision to promote dental education and provide research, scholarship, and all of that. But beneath that, I think, is the fact that we are the voice of dental education. We are here to represent our members, to the communities, and our staff is part of that team that does that. So it's very important that the staff get what the mission is, and that we are here to serve. We're here to serve our members and our board and the community and the public at large. And I think they do. I've never seen such a hardworking, mission-driven staff, quite honestly.
Yeah, and speaking of all of those great things, have you yourself taken on the role of mentor, especially for women in their careers? And if so, do you have any stories to share with us on how you've been able to pour into others?
Well, it's very interesting. I went through school in a time when there weren't a lot of women. There still aren't a lot of dental deans who are women. It's very, very, very low percentage. And when I've been in academics, I really tried to work with those women who wanted to advance, particularly the women who wanted to advance and have a family and have a career, because I went through this with two young daughters who are now 32 and 30. And so it was a struggle. It was a struggle. And I used to say that sometimes dental students were my babysitters and my kids grew up in the dental school. But I try to tell the young faculty with families that your kids will be fine. Your kids will learn. If they got babysitters, if they go with you to dental fairs or things, they're going to be so comfortable in the public eye in meeting people. It gives them a breadth of experience that you don't even think about at the time. And you're probably feeling guilty, because I did at that time. But I think it's important to realize that what you're doing with your career is helping them in the long run. That's so important. And I also tell young women, don't turn any opportunities down. It's so important to accept what you're offered, even if you don't know if you can do it or not, because you may not get that chance again. And you don't know where that will lead you. So I tell everybody to be, like I told my two daughters, be bold and brave, and you will succeed.
Yeah, love it. And, really appreciate you offering that up as ways that you've poured into other women, especially emerging talent. Quite, admirable. I also wanted to lift up how much of a champion Nonprofit HR sees you are in the DEI space and the work that you're spearheading with DEI inside of ADEA, a major, monumental initiative to tackle such, a necessary topic right now. What inspired you to take that on and lead the charge?
I think I saw so many of my faculty of students feeling like that they didn't belong, because there weren't numbers involved. We weren't able to recruit enough underrepresented minorities as faculty. They didn't see people teaching them who look like them. And it's important for our students to feel like they are at a welcoming and belonging environment. But sometimes I think we have blinders on to what goes on in our institutions, in our education environment. And it was time that we needed to look into it. When I was a faculty member, I had many, many young girls. I call them young girls, but they were dental students at the time, come to me with stories about harassment, bias, but they weren't willing to talk about it till after they graduated because they were in fear of retaliation. And so I could sense an underlying current that needed to be looked at. Hopefully, we could find it was much better than I thought. Okay. But at the same time, we needed to open that door and we needed to be comfortable bringing it out in the open and talking about it, because that's the key right there.
Yeah, I mean, you said you've advised your daughters to be bold and brave, right? That sounds like a bold and brave move. And I know it's ongoing. The work continues. Where would you say you all are on that journey?
Well, now you may not know this, but we're working with FASHUP, the other healthcare organizations, and we just put out a press release from 19 different health organizations on the need for men of color in the health professions. This was a joint effort brought about by a summit that we had here at ADEA in August. Bringing people together and talking about the need. So I think that's our next journey, is bringing the other healthcare professions on board and working with them, because there are some that have already been involved in this area, but there are others that have not at all, and they are reaching out to us to ask what are best practices.
Right now, there are women watching our conversation who may not have been on a women to watch list before, but no doubt are looking for inspiration and may also be wondering if what they are doing is really making an impact. Do you have any advice or insight for them?
I would say that you never know where you're going to be at any point in time. And I never thought I would be in this position to do that myself. Never, ever. But you keep going. And you have to realize that you are making a difference. You're making a difference to those who come after you. And I think that's very important for us to think about. We do what we do so our children and our grandchildren won't have to face the same type of discrimination, bias, unwelcomeness that perhaps we have. Even moving it an inch forward is important.
Yeah. What would you say is your greatest hope for ADEA? And how do you see yourself bringing that to fruition?
My greatest hope for ADEA is that we will continue this movement long after I'm gone, because there will always be someone or some group that need our help. We may be working in another country doing this. I don't know, but we have to influence. And that's why we're the voice of dental education. We have to influence what may happen in the Middle Eastern states. There's so much going on there that we could probably help with, just in general, with education in general. I've spent some time in Saudi Arabia, and I've seen a lot of changes there, but there are other countries that need to change as well. I would say, I hope that we will have that global impact, that we will have done our duty and performed our mission here in the US, and we moved outside of our borders.
You mentioned when we started this conversation that we can sometimes operate with an egocentric mindset in the States. So I'm wondering what your thoughts are regarding dental education and whether we as a nation are leading. And if not, where are our immediate opportunities for growth?
I think we're one of the leaders. I think we're ahead of the game in a lot of areas. But a lot of the other countries, for instance, the Scandinavian countries, they're very forward thinking in research and scholarly activity, and we can learn from them too. So I think what we have to do is take the best practices from each, but that involves being together. So that would be my wish, is that we take our best and we put it together, whether it be curriculum, whether it be practice, whatever it is. And we figure out what's the best model for both the patient and the student and the faculty, because we need to be able to provide the education, quality education, in as efficient, effective manner as possible.
Great. Thank you so much for that. Dr. West, my final question for you is, do you have a charge for other women in leadership inside your industry and as a whole in the social impact sector?
I would say, don't be scared. Don't let them get you down. Sometimes it seems like it's impossible, but it truly is possible. And that's been one of the themes of our organization's annual session. It is possible, because it just takes a few to build something great. So I would say keep working.
Thank you so much, Dr. West. It's been an absolute pleasure. Again, job well done. And we look forward to seeing what else is on the horizon for you in your career.
Thank you. I appreciate it.
Well, that's our show for today. What I found most inspiring in this episode, in hearing about Dr. West's experience, is specifically her advice to women to accept opportunities without fear of thinking that you can't do it, because you can, and you don't know where it will lead you. She says, be bold and brave and you will succeed. I love that. Don't let fear get you down, because truly anything is possible. And to never forget that wherever you are making a difference to those who come after you. That's such an important reminder. And I thank you for listening to The Switch. If you're looking for more episodes, please visit www.nonprofithr.com/The Switch. There you can find recordings and resources to help your organization maximize its greatest asset, your people.